Stephanie Grandy is a registered nurse who was fired from Presque's Northern Light AR Gould Hospital in the fall of 2021 for refusing to take the mandated COVID-19 shot based on her religious objections. At the time, Grandy had already recovered from COVID and had natural immunity. She had recently moved to Presque from Asheville, North Carolina. Separated from the support of her friends and family back home, she and her husband remained undaunted by the challenges of unemployment and, through faith in God, made it through the winter. Recently, Grandy announced that she has started a new business called Freedom Care. It is situated in her home and allows her to continue providing the wound and ostomy care she had been trained for. In addition to wound and ostomy care, she is able to perform ankle brachial index tests to determine if there is any reduced blood flow to the extremities.
So I've started my own wound and ostomy treatment clinic. I am doing both, seeing both patients in the clinic, and I can go out to their home, and I offer things that the hospital or other wound clinics may not offer, such as weekend visits, after-hours visits, more personalized care. I've been doing wound care for the last 4 years, as far as when I worked in dialysis and we would have to deal with Steele syndrome with patients when they had fistulas placed for their dialysis, and I would care for a lot of wounds in doing that. I would also, when I worked in behavioral health, I would go out into the community, and I had to deal with a lot of patients with wounds that had no access to health care. And so I had a van, I had a traveling van, and it was a large van that you could get in the back, and I had it set up like a clinic. And I did some wound care there and gave injections and things like that. So I was affiliated with a company in North Carolina that I worked for, but then I also did charity work to go out into the community. Asheville, North Carolina has a large homeless population, and there's quite a healthcare deficit in that population. And so I would take my free time and go out to the homeless shelters and out onto the streets and actually meet people where they were. So most of the time when someone comes to see a wound nurse, it's because they have a wound that isn't healing or a difficult wound. I do see surgical wounds that have dehisced, which means that they opened back up, wounds, burns, chronic wounds that aren't healing that people have had for years, like venous ulcers, arterial ulcers, diabetic ulcers, things like that. I see a wide variety of wounds, and it's generally, some acute wounds, but if someone comes to me with an acute wound, it's usually because they want to reduce the chance of scarring, such as a wound on their face.
Tapping into her creative side, Grandy has invented and patented an ostomy and fistula ring, which is custom-made to order. In addition to standard wound and ostomy care, Grandy is able to provide aquatic therapy at an indoor pool also located in her home.
So some people have trouble with weight-bearing exercises, and so the pool would allow them to get more exercise without it being hard on their joints. So if they're being treated for a wound, they cannot get in the pool because you cannot immerse open wounds into standing water. So they wouldn't be able to use the pool if they have a wound. But once the wound has healed over, then they could elect to use the pool for aquatic therapy.
Grandy is working with a group of nurses at Concierge Care to offer a functional medicine approach to her patients.
I am working with a provider who oversees and signs off on my work because that gives another eye on what I'm doing. I don't prefer to work independently. I like to have someone else looking at what I'm looking at and backing me up and helping me make decisions that are best for the patient. With the board-certified nurse practitioner overseeing all of my treatments, through her office, we are able to bill most insurance, including Main Care and Medicare.
You may contact Grandy via phone at 401-702-4298 or through secure email at sendsafe.to/freedomcarern@gmail.com. These stories and more in the print edition of the Fort Fairfield Journal. For WFFJ-TV, I'm Dave DeShan.